everyone, and welcome to our first High Five Policy podcast for 2026. I'm Lauren Ripplinger, Chief Public Policy and Impact Officer for AHIMA. Joining me today is the AHIMA Policy and Government Affairs team. With us today, we have Sue Bowman, our Senior Director of Coding Policy and Compliance, Kate McFadgen, our Senior Director of Government Affairs, and Andrew Tomlinson, our Senior Director of Regulatory and International Affairs. Thank you all for being part of this conversation today. I'd love to kick it off to the group and ask a general question, and that is, as of January 2026, what health information topics will really be the defining issue for each of your areas of expertise throughout this year?
I could go ahead and kick us off, Lauren. I think it's easy to say artificial intelligence. I'll just touch that there is the artificial intelligence executive order that the president did sign at the end of last year that's looking at state artificial intelligence laws and then determining and potentially challenging those in the court. But I don't think that's necessarily, from a regulatory perspective, going to be what the general focus is going to be for 2026. Last year, CMS was incredibly active as it relates to creating the health technology ecosystem and the interoperability framework. And they've continued to demonstrate that they are going to build on those announcements. We have the first deadlines for the pledges that they did sign, AHIMA did sign on, and is a pledgee of the health technology ecosystem, is a friend of the ecosystem, supporting those that are actually implementing many of the pledge requirements in there. Those first deadlines begin to hit at the beginning of this year, and by Q2, we'll have 2 or 3 different deadlines that have passed on the pledge requirements. It's clear that the work that Amy Gleason, as the director of the United States DOD Service, the USDS, is doing with CMS to implement the work of the pledgees and inside the interoperability framework is going to be what drives technology policy throughout HHS through 26. And I am really curious to see how that impacts the way that CMS works with the Assistant Secretary for Technology Policy, who's creating the technology itself. All of that builds to what is a major deadline for healthcare, which is going to be the electronic prior authorization deadlines. That's going to change the way that many health information professionals are going to interact with things like the payment and prior authorization processes in 27. And I think that's something that I'm really going to be keeping an eye on for 26.
Sort of in contrast to Andrew, when looking at Congress, I don't really think we're going to be able to get away from AI this year, especially because it is an election year, and that's going to be one of sort of the buzziest topics that we have going on. So I do think that this year, AI will once again be the defining issue for Congress. The past 2 years, AI has started and continued to gain prominence in Congress, but with not a ton of broad policy proposals behind them. 2024 was really a fact-finding year for Congress, doing a lot of talking to constituents and companies and figuring out what AI really was and what was happening. In 2025, we saw some additional proposals, including a proposal that was included in the reconciliation bill to hinder states' ability to regulate AI as opposed to the federal government doing so, some smaller proposals around protections for children and internet safety. But I think in 2026, the way AI is either helping, hindering, or affecting constituents is really going to be a consistent talking point. An emerging topic around AI that is getting bipartisan attention right now is data centers and the effects that they have on communities. So you can expect that to be a big talking point as we go towards the midterm elections. How AI is affecting the workforce is also going to be a major topic. Are companies relying more on AI? How does that affect the job market? And then, of course, innovation is going to be a huge buzzword in Congress. So how is AI affecting innovation? Is it spurring change? Is it making things easier for those in the healthcare industry, whether it's on the diagnostic side, on the non-clinical side? So really, I think that is going to be a big part of the conversation this year. But Sue, I'd love to hear from you as well.
Well, from a coding policy perspective, I'm not anticipating a specific coding policy topic I would describe as the defining issue in 2026, but I expect major areas of focus this year will be ICD-10-CM and ICD-10-PCS code proposals presented at the ICD-10 Coordination and Maintenance Committee meetings, as well as annual updates to the official coding guidelines.
Excellent. Thank you all. Kate, I want to talk a little bit about midterm elections, even though it is January and the election isn't until November. But as many of our folks in our audience know, all of the U.S. House of Representatives and 1/3 of the Senate will be up for re-election in the midterms. To what extent will that affect policymaking in Congress this year? And if so, how much will it affect it?
Absolutely. So election years are always very interesting with how they affect what Congress does and what they're able to do. We have about 20 fewer in session days in each chamber this year compared to last year. The Senate will be in session 149 days compared to 169 last year. And the House of Representatives will be in session 115 days compared to 136 last session. Looking at the calendar, as usual, the majority of Congress Congress will be in recess a majority of August this year, but also in October as they hit the campaign trail and really, work towards that election date in November. So it's really dealing with a shortened time frame to get things done. Most things are going to have to, be taken care of by July, really. They'll be back a little bit in September to maybe do some last minute things before the election. But a lot of what they have in priorities have to get done by July. And there is a long list of things to get done. So there is the fiscal year 2026 budget, which we are already in fiscal year 2026, but of course, Congress did not pass the budget on time last year. So we did experience a very long, in fact, the longest shutdown in history last year. So they did, at the end of that, pass a continuing resolution that funds the government through January 30th, along with passing 3 of the 12 appropriations bills that need to be passed to fund the federal government. So that CR expires January 30th. So right now we have 9 appropriations bills that fund the government that could expire January 30th if they don't pass other bills. Right now they've got a minibus that has been put forward covering commerce, justice, science, energy and water, and interior environment bills. So there is some progress being made. I would not be surprised to see another CR, even just a short-term one that allows them to sort of handle the larger bills like labor, HHS, but we'll see where they land on the fiscal year 2026 budget. As they wrap that up, they also have to start the fiscal year 2027 budget. That fiscal year, of course, starts October 1st. And with it being so close to the election, nobody wants to be in another shutdown at election time. So very likely that we will get another CR this year for FY27, but they will be working on that budget as well as they move through the year. We're also looking at some potential healthcare packages and bills this year that they need to get done. The House is set to vote this week to revive the ACA subsidies for 3 years that expired in December. And then Leader Thune in the Senate is also looking at options for a healthcare package that may include priorities such as minimum premium requirements for ACA plans and an expansion of tax-advantaged healthcare savings accounts. There is talk of another potential reconciliation bill, but with the thinning margins within, especially the House, it's unlikely, I think, at this point that they would have the ability to get another one done, especially before the election. It's not off the table, but it is becoming less likely. And then they've got comprehensive privacy reform. So the House Energy and Commerce Data Privacy Working Group are looking to introduce new data privacy legislation as early as this month. So we're waiting to see what comes out of the work that they did last year with the RFI that they released and how the meetings that they had and the conversations they had will really inform a potential comprehensive privacy bill. So that's another thing that could come out this year. So there's a long list of things to get done this year before the election. We'll see if they manage to get it all done, but that is what they are looking towards this year.
And Kate, you talked about the slimmer margins that in particular we're seeing in the House. Can you say a little bit more about those dynamics that Speaker Johnson or those headwinds that he's currently facing as we go into 26?
Sure. So as of this week, Representative Marjorie Taylor Greene has stepped down from the House. We also had an unexpected passing of Representative LaMalfa earlier this week, which brings the Republican majority to 218, which is kind of the minimum you need to have a majority with 4 current vacancies in the House. So it's really tough to pass anything with these sort of thin margins. Speaker Johnson can't really lose any votes at this point to pass anything. Again, depending on sort of who was in the chamber at the time, who's voting, but it's really thin margins. So if anything gets passed this year, it's much more likely that there might have to be some bipartisan talks getting to any sort of progress.
Absolutely. Sue, I want to ask a coding question of you, and that is, are there any new ICD-10 CM and ICD-10 PCS codes that are going into effect on April 1st? And what do you expect to see from coding policy as we head into this new year in 2026?
Sure. Yes, there are some new codes going into effect April 1st. The Centers for Medicare and Medicaid Services will be implementing 80 new ICD-10 PCS procedure codes. While no new ICD-10 CM diagnosis codes are being implemented on April 1st, the National Center for Health Statistics and the Centers for Disease Control and Prevention is implementing ICD-10 CM tabular and index addenda changes that will go into effect April 1st. And other coding policy news for the year, ICD-10 Coordination Maintenance Committee meetings will be held virtually on March 17 and 18 and September 15 and 16 to discuss ICD-10 CM and ICD-10 PCS code proposals. These meetings are open to the public, but pre-registration is required to attend. I'm sure there will be other coding policy developments throughout the year, but this is what I know for sure right now.
Excellent. Thanks, Sue. Andrew, you hinted at this before, talking a little bit about some changes that we've had at the Assistant Secretary for Technology and Policy, in particular between our last 2 episodes of the High Five Policy podcast. Most notably, that includes HTI 5 was released right before Christmas. So ASTP, formerly known as ONC, can still retain that title of the Office of No Christmas. What is the biggest takeaway that you have seen from just your early read of the proposed changes that are contained in this rule?
Yeah, the slumbering giant that is ASTP has finally sort of awoken. It's been a little quiet, I think, over the last year as we've waited for them to try to implement what some of the new administration's visions have been for the health IT landscape. HTI 5 is a rule that builds off of a deregulatory request for information that the agency did as a whole go through, and ONC was a part of, or ASTP was a part of, as well as seeking for feedback on areas that there could be for potential deregulation within the certification program. I think the biggest takeaway, there are things in HTI 5 that we expected to see, changes to information blocking on certain things, certain exceptions that we knew weren't necessarily the most popular that we're going to be ended up pulling out. But the number of certification criterion that have either been removed or adjusted or modified within the certification program is, I think, a lot larger than many within the health IT sphere expected, and it is really within the justifications of the rule itself, signaling a change in the way that ASTP ONC is looking at how the certification program will impact the way that health information flows throughout healthcare. Previously, the certification program and the criterion that are within it were really governing how data is collected and stored. The movement piece of it was the goal of what they wanted to do, but it was really starting at that basis understanding of, okay, let's try to make sure everything's uniform and how the technology itself functions. It'll make it easier to exchange. And ASTP ONC, within that justification of the rule, does state that they feel as if we have moved past that, and that some of the things like data, the types of data that are collected or the way that data is collected is something that has become standard across healthcare and will always be standard within these technologies. And they're starting to shift more into looking at ways of regulating and certifying the way that the electronic health record systems themselves talk to each other. So looking at how the Fast Healthcare Interoperability Resource, or FHIR, application programming interfaces, APIs, API and AI together is really going to trip me up, I think, all year, and artificial and application. But API and the FHIR APIs themselves are actually working at moving the data itself. And they say within the justification that this change within the certification program sets the stage for them to use certification as a way to manage how data is exchanged and how healthcare talks to each other within a data space. That change on the surface seems very technical and something that isn't necessarily going to change the way that healthcare itself collects and uses the data, but it could change the way that we actually receive and interact in the data. We'll have to see with the rule itself. It's only proposed. It's a 60-day comment period closing at the end of February. What changes once we do get the final rule? If you kind of track the way that some of these rules have worked across both the last two administrations, both the Biden-Harris administration and the current Trump administration, a lot of the rules that are proposed are pretty similar to what's finalized. There may be some slight subtle changes, and if this rule is finalized as proposed, it'll signal a massive shift in the way that electronic health records are certified by the HHS itself for use by providers, and thus the way that they'll be having those kind of conversations with their vendors and developers.
And thanks, Andrew. Still lots to dig through, but appreciate those initial insights on this rule, because there's a lot to dig into here. My last question for the team is really, if you were, or you are, in Sue's case, a health information professional, what's the area of policy you keep the closest eye on for this year?
I can start with that, because an area comes to my mind right away, and that's the area of artificial intelligence. Kate talked about that a little earlier, and I think we've all seen in the news and elsewhere that it's a huge and growing field, rapidly expanding, and I think it's going to be a major focus of policy initiatives going forward.
I would agree with Sue that that's a great thing to keep an eye on. In my hope, I think I would hope that HI professionals would really focus on a lot of AHIMA's priorities, including the Match It Act, the bill that we have helped introduce in the House of Representatives to address issues around patient matching. So we continue to push that on the Hill. It will be a goal of ours to take to the Hill again for Advocacy Summit this year. So registration is still open if you would like to come with us to the Hill in March and take that. But I'd also say, just pay attention to the fact that it is an election year, and you never have more of a say in government than when your elected official is courting your vote. So go to the town halls, call your representatives, send emails, make sure that you get your voice in there so that your elected official knows that they need to earn your vote, and pay attention to these types of issues.
That's a great point. And for folks that are interested in weighing in on the Match It Act, you can go to our Grassroots Action Center on ahima.org. It's really a quick, easy way to voice your support. Doesn't take you more than 2 minutes. So encourage folks to check that out. Andrew, I think you have the final say today.
I do. And while Kate was talking about all the different deadlines that Congress has for this year, the administration doesn't have as many must-dos for the year, but they've certainly come out swinging so far already, outlining a number of changes, whether or not that's to things about how food underneath the MAHA program, or changes within the CDC and FDA. And I expect there's going to be changes in other areas within HHS that will be finalized in rapid succession, especially at the front half of this year. One of those that I think HI professionals should pay attention to is in the area of privacy. The administration last year, as part of the regulatory agenda, indicated they have plans to finalize both HIPAA privacy and security proposed rules from the last 5 years in the May timeframe for this year. We'll see if they actually make May, but that will be a major change for the way that the HIPAA privacy rule and security rule are implemented on the ground level. And I really think that's an area that can be a real tangential piece of work for the HI professional to focus on for this year, and things that they can help build towards within their organization to continue to demonstrate the value of HI professionals in making sure that compliance activities are happening at the highest level, so organizations are prepared for these changes. And that's where I would focus if I were them for this year.
Excellent. I want to thank my colleagues for this great conversation. I always enjoy when we have a chance to host the podcast and talk through these issues. We're excited to bring more episodes and different topics to this audience in the new year. And I hope you all have a great day. And thank you to the team for sharing their thoughts and insights for this year.